Welcome to this informational explainer. We often treat our hearts like a reliable engine, right? A machine that'll just keep ticking away forever until, suddenly, it stops. But today, we are completely decoding the true mechanics of cardiac health. We're skipping the dry textbook definitions and unpacking the real biological realities behind the causes, the symptoms, and the actual real-world prevention strategies for heart attacks. We're going to dive deep into what's literally happening at a cellular level inside your body, turning all those complex medical guidelines into structured, actionable insights. So if you're ready to look past the surface and really understand how to protect your body's most critical engine, let's get right into it. Honestly, Hollywood has totally sold us a lie on this one. In the movies, a heart attack is always the sudden, unpredictable lightning bolt out of nowhere, right? A character clutches their chest and just collapses without any warning. But the clinical reality, it is way more insidious. Heart attacks actually do not happen suddenly. In fact, your cardiovascular system has probably been dropping hints for years. We are talking about a really slow, silent progression where arterial plaque takes literally decades to build up. Sure, the catastrophic event itself might feel instantaneous when it finally hits a breaking point, but the groundwork for that medical emergency, that was laid down day by day, month by month. Grasping this timeline is absolutely crucial. It's actually your biggest advantage, because it means you have this massive window of opportunity to intervene long before the credits roll. So to figure out how to intervene, we have to look at the exact mechanics of that buildup. What physically happens during an episode? Well, a heart attack, or if we want to use the medical term, a myocardial infarction, happens when an artery that delivers blood right back into the heart itself gets completely blocked. The usual suspects here, a buildup of fat, an accumulation of cholesterol, or the sudden formation of a blood clot right on top of that plaque. When that pathway gets choked off, the blood flow just stops, and since blood is what carries oxygen, we rapidly enter this really dangerous state called ischemia. Now, this isn't just some temporary pause in function. Without oxygen, those heart vessel cells begin to literally starve and die within minutes. That rapid cellular starvation, caused by a physical blockage in the coronary artery, is the literal definition of a heart attack. It is essentially a localized famine happening right inside your chest. Which brings us to the compounding factors that actually accelerate this dangerous buildup. It's kind of like an ecosystem of risk. We've got the well-known underlying conditions, high blood pressure acting almost like sandpaper on your artery walls, high cholesterol providing the sludge, and diabetes complicating the blood flow. Then you throw in lifestyle choices, smoking, obesity, a stagnant daily routine, an unhealthy diet, and you've got a perfect storm. But you know what the most fascinating and honestly most ignored factor is here? Continuous mental stress. Chronic stress isn't just a feeling, it is a physical state. It floods your system with cortisol and adrenaline, which actively triggers inflammation in your arteries. That makes it significantly easier for all that fatty plaque to stick and harden. These aren't just isolated checkboxes on a doctor's chart. They feed off each other, silently narrowing the margin of error in your blood vessels every single day. Now, despite all that slow, silent buildup, there inevitably comes a breaking point. When a critical blockage finally happens, your body's alarm system goes off, and you need to know exactly how to interpret it. The primary, absolute most prominent warning sign is severe chest pain, or a feeling of immense crushing pressure. Patients often describe this not as a sharp stabbing ache, but more like having an actual elephant sitting squarely on their chest. It's intense. This visceral, overwhelming weight is your heart muscle literally screaming that its oxygen supply has been critically cut off. It's the physical manifestation of that ischemia we were just talking about, and it is a signal that demands immediate, uncompromising attention. But here's the thing, that crushing sensation rarely stays confined to just the center of your chest. A massive red flag is when the pain starts radiating outward. It often travels down the left arm, up into the shoulder, climbs the neck, or even settles right into the jaw. So why does this happen? Well, it's this fascinating medical quirk called referred pain. Your heart doesn't have as many dedicated pain receptors as your skin does, and the nerves from your heart share the exact same pathways in your spinal cord as the nerves from your left arm and jaw. So when your heart is in profound distress, your brain actually gets confused about where the signal is coming from, and it interprets the pain as radiating into your upper body. If you ever feel that sudden spreading discomfort, do not ignore it. It is not just a weird muscle cramp. It's your brain decoding a massive systemic alarm. Now, this is where the emergency picture gets incredibly nuanced and, honestly, where a lot of fatal misunderstandings happen. Alongside the chest pressure and that radiating pain, an attack often triggers sudden difficulty breathing, unprovoked cold sweats, and extreme nausea. While those might seem like secondary symptoms,
there's a totally crucial fact you need to know. For women, these quote-unquote secondary physical distress signals, things like extreme fatigue or profound nausea, are often the primary or sometimes even the only symptoms they experience. This difference in biology frequently leads to tragic misdiagnoses, where women are just told they have indigestion or anxiety. Listen to me. If this cluster of symptoms hits, regardless of your gender, you are facing a severe medical crisis. In cardiology, they say time is muscle, and restoring that oxygen flow immediately is the only priority. Okay, let's take a deep breath. We've covered the heavy, urgent reality of an attack. But here is the most empowering part of this entire explainer. Because cardiovascular disease is largely the result of long-term habits, it is incredibly preventable. And the daily prevention plan? It's remarkably straightforward. First up, commit to at least a 30-minute daily walk. This doesn't just burn calories, it physically trains your blood vessels to expand and contract efficiently, keeping them nice and flexible. Second, maintain a balanced diet and absolutely eliminate smoking. No excuses there. Third, get regular checkups for your blood pressure, sugar, and cholesterol so you can actually catch any of those invisible internal shifts. And finally, to combat that chronic cortisol we discussed earlier, prioritize proper sleep and active stress reduction. These are not drastic, impossible life overhauls. They are simple, daily biological investments that put the control right back in your hands. Now, as much as your daily habits are your strongest armor, there is a fundamental rule we absolutely have to respect. You cannot self-treat a medical emergency. The insights we're unpacking today are strictly for awareness and long-term prevention. If you or someone around you ever experiences the symptoms we just outlined, do not try to diagnose the problem at home, and definitely do not wait around to see if it just passes. An active heart attack is a life-threatening crisis that requires immediate professional intervention. If those alarm bells go off, your one and only job is to contact a nearby hospital or emergency service instantly. Just let the medical professionals do what they do best. So thank you so much for sharing your time with us today and investing in your own cardiovascular intelligence. If you found this explainer valuable, make sure to follow and subscribe so you never miss out on our future health deep dives. But before you step away, I want to leave you with a question to really ponder. Think about your exact daily routine right now. Which one of your habits is secretly building your future health, and which one is silently threatening it? The choice of what you do next is entirely yours. Let us know in the comments which health issue or medical mystery we should decode next. Until then, stay focused, stay healthy, and keep learning.